Suicide is a severe health concern worldwide. It is widely recognized that early intervention is the most effective approach for suicide prevention. However, those who kill themselves, more than 90% have experienced some form of mental illness, especially those with diagnosable mood disorders such as MDD and BD are at high risk for suicide. Hence, accurate and early detection of individuals suffering from mood disorders is vital to ensure timely suicide prevention. Bipolar disorder, called BD, is characterized by recurring intense mood swings ranging from depression to manic, which include an elevated mood, impulsivity, and racing thoughts. On the other hand, major depressive disorder, called MDD, is characterized by persistent sadness and a loss of interest, etc. While depressive episodes in bipolar disorder are similar to those in MDD, critical distinction arises from manic episodes. However, according to the previous studies, up to 50% of BD is misdiagnosed as MDD. This is because more than 58% of individuals with BD undergo depressive episodes before experiencing manic episodes and seek help during these phases. Also, they often tend not to perceive manic as abnormal, and some could even find these states preferable, leading them to recognize themselves as MDD. Since BD and MDD require distinct treatments and prognosis, misdiagnosis can lead to significant delays in receiving proper treatment and can also increase the risk of suicide. Therefore, precise identification of patients who may develop BD after an initial diagnosis of MDD is of great clinical importance. Importantly, due to a huge gap in understanding prognosis between real-world and clinical settings, where clinicians' interaction with patients is limited and relies on patient subjective words, there is an emerging interest in utilizing real-world data from non-clinical contexts like social media to gain insights into distinct behavioral traits that can be linked to BD and MDD. However, while several studies have suggested methods for analyzing mental states, including BD and MDD using social media data, little attention has been paid to detecting a shift in diagnosis from MDD to BD. Instead of a one-time diagnosis in a clinical setting, a behavior trait of an individual who develops BD after a diagnosis of MDD can be comprehensively captured using longitudinal social media data that includes dynamic mood variation across time. Therefore, this study aims to detect BD risk among patients incorrectly diagnosed with MDD or wrongly perceived as MDD using their historical mood fluctuations revealed in their past social media activity. To this end, our approach and contribution can be summarized 3 points. First, we create the novel BD risk dataset including mental disorder diagnosis and BD mood level validated by clinical experts. Second, we developed a multitask learning model for predicting the BD risk of patients who initially misdiagnosed MDD on social media. Lastly, we propose an interpretability of the model which can help clinicians understand their patients comprehensively. To construct novel data set, we collected posts from the representative bipolar and depression-related subreddit using the open-source Reddit API. To label the collected data set, we recruit 3 researchers knowledgeable in psychology as annotators. With the supervision of a psychiatrist, the trained annotators labeled anonymized Reddit posts. During annotations, we mainly consider 2 different label categories: mental disorder diagnosis and bipolar mood levels. We validate the annotated dataset with 2 psychiatrists from Samsung Medical Center. The results suggest that our annotations in the dataset are reliable, and we make this valuable dataset publicly accessible. If you want to request datasets, please check this QR code. Our dataset stands alone in encompassing not only diagnosis for BD and MDD, but also detailed BD mood information validated by psychiatrists. The problem definition and our proposed multitask learning model aim to detect the BD risk for users initially diagnosed with MDD, estimate BD mood level, and assess mood variation from their post over time. The model includes 3 main components: a temporal convolution layer, a dynamic mood-aware attention layer, and a prediction layer. Further details on each component are described in our paper, so please check it out. We evaluate various baselines for comprehensive performance comparisons. As studies on identifying BD risk and BD mood are limited, we adopt the following related baselines. For example, BD detection and MDD detection, LLMs, and other mental status detection models. Overall, the proposed model outperforms all the baselines regardless of task. Specifically for the BD risk detection task, the dynamic mood-aware attention layer can effectively generate temporal contextual features by gaining deeper insights into the author's historical mood. However, despite the high performance in predicting BD mood level, the results for predicting mood variation are relatively moderate and comparable. Our analysis reveals that there is a trade-off between these 2 tasks, and enhancing the performance of both tasks is future work. Notably, the performance of the proposed model using multitask learning is superior to employing single-task learning in both tasks. We believe that capturing BD mood is useful in identifying BD risk, and hence jointly learning both tasks can improve performance by facilitating the transfer of informative representations and parameters among the tasks. Based on the ablation study, we observed considering both mood level and variation is helpful in monitoring BD risk, and uncertainty weight loss approach for multitask learning effectively manages the task weights during training, particularly considering their distinct levels of granularities. This careful balance prevents any individual task from dominating the overall objective function, ultimately enhancing the overall performance. Since BD patients often exhibit recurrent mood swings, a substantial duration is required to observe their mood patterns. Therefore, we define a timeline that contains the past month for observation and future months for identifying BD diagnosis with a series of posts of a user. As a result, we found predicting next 24 months BD risk based on the previous 24 months post-sequence durations performs best. We also analyze how the model assigns the attention weights from the dynamic mood-aware attention layer to each post over time in predicting BD risk. Model tends to have a higher attention score when the mood level is alleviated, which aligns with manic symptoms. We believe the proposed model with interpretability has the potential to screen and detect individuals with BD on social media, allowing for early clinical intervention. In summary, we created a clinically validated novel dataset, BD risk, and we demonstrated that jointly learning BD mood can enhance the performance of BD risk detection among users misdiagnosed with MDD. The dynamic mood-aware attention offers insights into BD mood's impact on future risk. And the proposed models can be used for monitoring risk of mental disorder for not only individuals with social media, but also those who are underrepresented in a clinical setting. Thank you for your attention.